Mrs. Amna, 38 years old.
Okay.
Your time starts now.
Good morning, Mrs. Amna. I'm Dr. Fareen. How can I help you today?
Doctor, actually, I'm feeling stiffness in my hands.
Mm-hmm. Can you tell me more about it?
Yes, doctor, it's been going on for like 4 months now, and it's getting worse, and I cannot do anything properly. I feel pain in my hands in the morning.
Okay. Okay. So, Mrs. Amna, I just want to ask few more questions. Is that okay?
Sure, doctor.
Okay. So, you told me you are having this problem since 4th month, right?
Yes, doctor.
So, is this stiffness occurs in both of your hands or in the one hand?
Yes, doctor, it occurs both in both hands.
Okay. And okay. So, is it started all of the suddenly or gradually?
It was there. It's gradually it was getting worse and worse.
Mm-hmm. Okay. So, do you have pain in your small joints of your hand?
Yes, doctor.
Okay. And may I know that what type of pain is this?
Doctor, it's mostly pain and stiffness. When I do anything, then I feel more pain.
Okay. And may I know that in what time of the day do you feel more pain, like in the morning or in the evening?
Mostly in the morning.
Mm-hmm. And do you have joint stiffness along with that?
Yes, doctor. Sometimes in my wrist and sometimes in my ball of feet in the morning.
Okay. Okay. So how much stiffness lasts for how much minutes?
Maybe 60 minutes, doctor. An hour and a half.
Okay. Okay. So Mrs. Amna, if I'm asking on the pain scale that how severe your pain is, can you just score it?
Doctor, it's like 6 or 7 out of 10.
Mm-hmm. And anything that aggravate your symptoms?
Um, no, doctor. I didn't notice. It's just in the morning when I wake up.
Mm-hmm. And anything that gives you relief
At the end of the day, I feel better.
at the end of the day. Okay. So, Mrs. Amna, do you have any other joint involvement, like any knee joint?
No, doctor.
Okay. Do you have any other long-standing illness, like any joint disease?
Doctor, not any joint disease, no previous history of anything else.
Okay. And is any member of your family affected with the similar illness?
Doctor, my mother had kind of arthritis when she was in her
Oh,
40s.
okay. And how she is now?
She is doing good on tablets.
Okay. Okay. So, Mrs. Amna, are you taking any drugs for it?
For the pain, sometimes I take Brufen, doctor.
Okay. So, are you a diagnosed case of any arthritis, like any joint
No,
disease?
no, doctor.
Okay. And have you noticed any change in your eye?
No, doctor.
Okay. And do you have any history of fever?
No, doctor.
Any history of weight loss?
I almost lost 2 kg over last 3 months.
Mm-hmm. And any history of back pain?
No, doctor.
And have you noticed any changes in your nail?
No, doctor.
Okay. Okay. So, Mrs. Amna, what do you do for living?
Doctor, I'm a housewife.
Mm-hmm. So, do you smoke?
No, doctor.
Do you take alcohol?
Yes, doctor, occasionally.
Mm-hmm. And have you ever tried to cut it down, Mrs. Amna?
No, doctor. I'm just taking it on weekends or socially.
Okay. Okay. So, Mrs. Amna, who do you live with?
Live with my husband.
Okay. And I just want to ask a private question. Is there any difficulty in maintaining a private relationship with your husband?
No, doctor.
Okay. And when was your last menstrual period?
It was almost now I feel 5 weeks ago.
5 weeks ago. And did you do any pregnancy test?
No, doctor. My periods are mostly irregular.
Your periods are irregular, right?
Hmm.
Okay. So, okay. So, how was the flow of your periods?
Sometimes it's fine, sometimes very scanty.
Mm-hmm. And is are your periods irregular since how many months?
6 to 7 months now.
Okay, 6 to 7 months. Okay. Okay. So, Mrs. Amna, what do you think? What's crossing your mind?
Doctor, I just feel like maybe this bone disease like my mother.
Mm-hmm. And anything that worries you most?
I'm worried about ending up disabled and deformed hands.
Okay. Okay. Mrs. Amna, what do you expect from me today?
Doctor, can you just give me any diagnosis or any pain relief? I just want any treatment option.
Sure. Okay, I will tell you each and everything in detail. Don't worry about that. Mrs. Amna, how far this thing impact your life?
Doctor, I just cannot function properly. I cannot grip kettle or open jars or even not button the clothes also.
Mm-hmm. Okay, I can understand. Mrs. Amna, I just want to quickly summarize it. Okay, you told me that you are having this problem since 4 months, that your joint, is small joints of your hand, they become stiff and you are having pain in the joint. And you are so worried about because your mother is also having joint disease. And anything that you want to add in this?
No, doctor, and this I'm fond of doing this cooking and knitting, but I cannot because of this pain.
Okay, okay, I can understand. Okay, so Mrs. Amna, I just want to quickly examine you. Is that okay?
Sure, doctor.
Okay, so in the presence of the chaperone and after sanitizing my hand, I will start my examination by checking the vitals first and start with the general physical examination, checking anemia, jaundice, and okay, I will also examine the hand first on the inspection, and then I will check both of the hands, any deformity, any nail changes, any compare the temperature of both of the hands, and then I will palpate thenar and hypothenar muscles and I will also palpate small joints of the both of the hands, and then I will do the movements of the hands like flexion, extension, and lateral uh, flexion and extension by making the fist. And okay, and I will also check the sensation of the hand. And I will also check the eye, any infection, any changes in the eye, thyroid gland, and checking the bases of the lungs. And I will also check the edema.
Okay. Tissue swelling on MCP and PIPs bilaterally, warm, tender to palpation, and no fixed deformities. Otherwise, well.
Okay. Okay. So, Mrs. Amna, after taking history and after examining you, most probably you have a condition which is called rheumatoid arthritis. Do you have any idea about this?
No, doctor.
It is basically the inflammatory condition. Sometimes what happened that our immune cells they get mistakenly damage our cells, and that's why you are having this type of problem. Are you getting my point?
Oh, doctor, is it really dangerous?
Yes, because there are if it's not treated, then it will cause multiple complications that like it will affect your heart and your other organs of the body. Okay, Mrs. Amna.
Okay, doctor.
So I will offer you few of the investigations to confirm the diagnosis. Right. First, I will just check your pregnancy test, okay, and then CBC, ESR, CRP, anti-CCP antibodies, and rheumatoid factor, and
Okay.
urea
Test
electrolyte,
positive
retinine, and
for
LFTs, and renal function test.
anti-CCP positive.
Okay. Oh, and pregnancy test.
Pregnancy test negative.
Okay. Okay. So, Mrs. Amna, as your test is positive, so it shows that it confirms that you are having a condition called rheumatoid arthritis. So, right now, I'm just making a referral letter for you and sending you to the specialist. A specialist will start drugs, which is called DMARD. Are you getting my point, Mrs. Amna?
Yes, doctor.
As you are worried about that you cannot do knitting and it's really difficult to make the food, so I'm just refer you to the physiotherapist and occupational therapist. They will advise tell you that how to improve your symptoms. Is that okay, Mrs. Amna?
Okay, doctor.
Moreover, I'm just giving you a painkiller tablet. Do you have any burning sensation in the middle of the chest?
Yes, doctor. I have this burning heart pain. Chest
Okay,
pain.
Okay, so I'm giving you tablet paracetamol with codeine. You can try it by 500 milligram 3 times a day. Okay, and if your symptoms are not controlled, then we can switch to other drug, which is tablet brufen along with the NSAIDs, along with the antacids. Is that okay?
Okay. Time's up.
Moreover,
Okay, doctor.
okay, thank you.
Okay, your second case is Mr. James, 37 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Okay, good morning, Mr. James. I'm Dr. Fareen. How can I help you today?
Doctor, I get this horrible attacks of pain in my head.
In my head. Okay, Mr. James, can you tell me more about this?
Yes, doctor, sometimes it's really horrible that I feel like banging my head on the wall, and it's several times in the week. Like last 3 weeks, I was getting it 2 to 3 times daily, and almost it lasts for 30 to 90 minutes, and then completely gets normal.
Okay, and Mr. James, I just want to ask you more questions. Is that okay?
Sure, doctor.
Okay, so Mr. James, may I know that since how many weeks, since how many months you are having this problem?
Since 3 weeks.
Since 3 weeks, and you told me that you are having this type of headache several times in a month, right? Several times in a week, right?
Yes, doctor.
So within a day, then how many times do you have this attack?
Doctor, 2 to 3 times.
2 to 3 times. Okay. So Mr. James, is it started all of these suddenly or gradually?
Yes, doctor, I didn't know how it started suddenly, and it's quickly like on one side of my head, and it was really painful.
Mm-hmm. Okay. So Mr. James, is it localized only to your one side of your head, or does it go to the anywhere else?
Only one side.
Okay, only one side. And may I know that, okay, what type of headache is this?
Doctor, it's intense, burning and piercing, like far worse than any past headache.
Mm-hmm. And mostly, on which side do you have headache?
Left,
Like right or
left
left?
side.
Left side. And if on the pain scale, if I'm asking on the severity of the pain, then how severe it is?
Doctor, I would say 10 out of 10. Sometimes I just cannot bear this pain a lot.
Mm-hmm. Okay. And anything that aggravate your pain?
Doctor, I don't remember. Just it starts suddenly.
Mm-hmm. And anything that gives you relief?
No, doctor. Nothing gives me relief.
Okay. So, Mr. James, you have this problem since many months. So, did you take any medicine for it?
No, doctor, it's not many months. It's just 3 weeks and 2 to 3
Yeah.
times a day. Yeah.
Yeah.
Only
So,
Brufen I took, but I don't know, it didn't resolve it.
okay. Okay. So, Mr. James, do you have any like do you have any nausea,
No, doctor.
any vomiting?
No, doctor.
Okay. And do you have before the headache any flashing lights before your eyes?
No, doctor.
Okay. Do you have any hearing sensitive to the noise at the time of the headache?
No, doctor.
Okay. Okay. So do you have this type of headache, especially around the eye?
Yes, doctor, my eye feels so bad and it starts tearing also. And
Mm-hmm.
it becomes
Okay.
red and my eyelid droops, and I also have nasal congestion with this.
Right, right. And is it only on the one side, like left side of the eye, right?
Yes, doctor.
Okay. Okay. So, do Mr. James, do you have this type of attack ever before, like before 3 weeks?
No, doctor.
Okay. So, Mr. James, do you have any long-standing illness?
Doctor, no, I don't have.
Okay. And do you still have headache right now?
No, doctor.
Okay. So, is any member of your family affected with similar illness?
No, doctor.
Okay. So, Mr. James, are you taking any drugs on the regular basis?
Any? No, no, doctor. I only take this Brufen
Uh,
sometimes.
Right, right. You took Brufen, right? So, Mr. James, what do you do for a living?
Doctor, I'm a bank accountant.
Mm-hmm. And is this headache affect your quality of work?
Yes, as soon as it starts in the morning, I just leave my work. I cannot do anything.
Mm-hmm. Okay, I can understand that how difficult it must be for you, Mr. James. Mr. James, do you smoke?
Yes, doctor, I do 15 cigarettes a day since 15 years now.
Mm-hmm. And have you ever tried to quit it down?
No, doctor.
Mm-hmm. So, Mr. James, you know that smoking is bad for the health. So, how about if you ever think about quitting the smoking, then just come back to me, then we will talk about this. How about that?
Sure, doctor.
Okay. So, Mr. James, do you take alcohol?
Yes, doctor, very often. And these days, since I have these headaches, I try to take more, but sometimes everything is getting worse, even with the alcohol.
Mm-hmm. Okay. You know, Mr. James, that alcohol is not good for your health. Just try to cut it down. How about that?
Doctor, this is the
Okay.
only thing that relieves me. Okay, doctor.
Okay. Okay. We will discuss this thing later. Okay, Mr. James. And what about your diet? Do you take excessive caffeine?
No, doctor.
Mm-hmm. Okay. So, who do you live with?
I live with my wife and one kid at home.
Mm-hmm. And do you have any idea what's your weight according to your height?
And 33.
Okay. Okay. So, Mr. Ahmed, Mr. James, what's crossing your mind?
Doctor, I just Google and on internet they said it's a migraine.
Mm-hmm. And anything that worries you most?
I'm just worried about any brain tumor because it's severe kind of pain.
Yeah. Okay. Mr. Ahmed, I will tell you in detail. Don't worry about that. Mr. Ahmed, what do you expect from me?
I just want any fast acting treatment for these attacks and sometimes to prevent them.
Okay. Okay. So, Mr. James, how far this thing impact your life? As you told me earlier that your work is affecting. Anything else that you want?
No, doctor, just work and any time when I'm sleeping also. Sometimes it wakes me up from the sleep.
Mm-hmm. Okay. Okay. So, Mr. James, I just want to quickly summarize it. You told me that you are having this severe type of the headache on the one side of the head, and that involved your one side of the eye with lacrimation, with like watering of the eye, and you are having these symptoms since 3 weeks, and you are so worried that maybe it's brain tumor. Is there anything else you want to add?
No, doctor.
Okay. So, Mr. Ahmed, I just want to quickly examine you. Is that okay?
Sure, doctor.
Okay. In the presence of the chaperone and after sanitizing my hand, I will start my examination with the journal physical examination, checking vitals. First, BP, pulse, temperature, respiratory rate. I will start with the journal checking anemia, jaundice, and checking the eye. Any sign of swelling and redness and edema, and I will also check the nose and throat examination, checking the thyroid gland with carotid bruise, and after I will also check um, I will also check the basis of the lungs, and I will also palpate.
Hello?
Hello,
Hello?
hello, hello,
Yeah.
hello. Do you hear me, Miss Dr. Sarah?
Hello, Dr. Fareen, can you hear me? Sorry, I got disconnected.
Yes, I can hear you. You can hear me?
Yeah, I paused the timer. You did your examinations?
Yes, I'm just doing my examination.
Okay. Right now, patient is. Did you do any neuro examination? I paused your timer, by the way.
Okay, so I'm just doing the examination. I'm in the middle of the examination.
Okay, okay, sure. Carry on.
Okay, so I will just check the back of the eye. I will after I will examine the back of the eye like switching off the lights, and I will check the ears and nose, and I will palpate their scalp, and after I will check all the cranial nerves, and I will check the basis of the lungs and checking the edema, and I will also check the reflexes.
Currently, everything is fine, normal.
Okay. Okay, so Mr. James, after taking history and after examining you, most probably you have a condition which is called cluster headache. Do you have any idea about this?
No, doctor.
Basically, it is a type of the headache that occur on the one side of the head, and it involves the eye, and it occurs in the bouts, right? So we cannot say that what was the reason behind this, but this condition can be controlled with the drug. Are you getting my point, Mr. James?
Okay, doctor.
So right now you are not in pain, so I'm not referring you to the hospital, because in the acute pain you have to go to the hospital for oxygen, right? Its treatment is the oxygen. Is that okay? So
Okay, doctor.
right now, I'm just offer you few of the advices like lifestyle modification. Just whenever you are feeling of any headache, just lie down in a quiet room and just switch off the lights, and increase intake of the fluids. And as you took alcohol, so how about just cut down the alcohol, because it will not relieve your headache. Is that okay?
Okay, doctor.
And Mr. James, you are thinking about that it must be something serious. So it's not that serious. It's not a tumor. It's a type of the headache. Okay.
Okay, doctor.
Moreover, I'm giving you a drug for the for the prevention of the other headache, which is tablet verapamil. You can take it. I will check the dose with the. I will check the dose and then tell you later. Is that okay?
Okay, doctor. Should I start it from today? Time, sir.
Ah, okay.
Okay, Dr. Farheen. Your last case is okay. Mr. Musa, 35-year-old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Okay. Good morning, Mr. Musa. I'm Dr. Fareen. How can I help you today?
Doctor, actually, I have been coughing for over a month now and I'm losing weight.
Mm-hmm. Mr. Musa, can you tell me more about it?
Yes, doctor, it's like 6 weeks I'm getting this cough more and more. Mostly it's dry, but now I feel a small amount of sputum. And I'm
Mm-hmm.
also losing some weight.
Right. Okay, Mr. Musa. So sorry to hear about that. I just want to ask few more questions. Is that okay?
Sure, doctor.
Okay. So, Mr. Musa, you told me you are having this problem since 6 weeks, right?
Yes, doctor.
Okay. So, have you ever checked your? Do you have fever?
Not a lot, doctor, but I feel night sweats.
Mm-hmm. And you told me that you are having weight loss, right? So, have you ever checked that how much you lose your weight?
5 kg in 2 months.
Mm-hmm. Okay. Okay. So, Mr. Musa, are these symptoms started all of these suddenly or gradually?
Doctor, it's just started gradually.
Mm-hmm. And you told me that you are having cough with sputum. So, have you noticed any change in color? What's the color of your sputum?
Sometimes it's yellow, sometimes white.
Mm-hmm. And have you noticed any blood in it?
Yes, doctor, sometimes it's occasional streaks of blood.
Okay. Okay. So, Mr. Musa, do you have these symptoms ever before, like before 6 weeks?
No, doctor.
Mm-hmm. Along with these symptoms, do you have any shortness of breath?
Yes, doctor, mild when on exertion.
Mm-hmm. Any chest pain?
No, doctor.
Okay. So is anyone in your surrounding have similar symptoms?
No, doctor.
Okay. Okay. So, Mr. Musa, do you have any long-standing illness?
No, doctor.
Okay. And is any member of your family affected with the affected with condition like TB?
No, doctor.
Have you ever diagnosed with TB before?
No, doctor.
Okay. So, Mr. Musa, are you taking any drugs on regular basis?
No, doctor.
Okay. So, you have this condition since 6 weeks. So, did you go for any checkup and do for
No,
any
doctor. Just
investigations?
no.
Okay. So, Mr. Musa, is there any history of hospitalization before?
No, doctor.
Any history of drug allergy?
No, doctor.
Okay. So, what do you do for a living?
Doctor, I work in a restaurant kitchen.
Mm-hmm. Okay. And is anyone in your workplace have similar symptoms like cough and fever for a long period of time?
I didn't notice, doctor. I just feel like it's for first I am the one who's coughing all around.
Mm-hmm. Okay. Okay. So, Mr. Musa, uh, do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Any other recreational drugs?
No, doctor.
Okay. Okay. So, who do you live with?
Doctor, I live in a shared accommodation with several other men.
Mm-hmm. Okay. And any other members in your accommodation have same symptoms?
I feel one of my colleague might be having similar. He was coughing yesterday, but I didn't give it a
Mm.
thought.
Okay. Okay. So, Mr. Musa, I just want to ask a private question. Are you sexually active?
No, doctor.
Okay. And what's your okay? So you told me you have lost some weight in the past 6 weeks, right?
Yes, doctor.
So do you have any idea what's your right now? What's your BMI weight according to your height?
Maybe 21.
21. Okay. So Mr. Musa, what's crossing your mind?
Doctor, I'm just worried like it could be something serious because my friend was telling me it could be a TB.
Mm-hmm. Anything that worries you most?
I'm worried about infecting the housemates and losing my job.
Right, right. I can understand that how difficult must be for you. And Mr. Musa, how far this thing impact your life?
I just want to know any test needed and if it's curable.
Mm-hmm. And anything that you expect from me apart from this?
No, doctor, only this
Okay, so Mr. Musa, I
treatment.
just want to quickly summarize it. You told me that you are having cough with you are having cough and with symptoms of the weight loss in 6 weeks, and you are so concerned about that maybe it's the TB, and you need some treatment and some of the test. Is there anything else you want to add?
No, doctor.
Okay, so I just want to quickly you quickly examine you. Is that okay?
Sure, doctor.
Okay, so Mr. Musa, in the presence of the chaperone and after sanitizing my hand, I will start my examination will by checking the vitals first, checking BP, pulse, respiratory rate, and temperature. And I will start with the general physical examination, checking anemia, jaundice, and checking the throat examination. I will also check the basis of the lungs. I will also check the detailed respiratory examination, and I will also check the edema of the feet.
Okay. So your patient is 37.8 and
Mhm.
96 oxygen saturation crackles on bronchial breathing in the upper zones and otherwise normal.
Okay. Okay, so Mr. Musa, after taking history and after examining you, I before confirming the diagnosis, I just offer you few of the investigations. How about that?
Sure, doctor.
Okay, so I just offer you CBC, ESR, and I being expert and AFB smear. I will take. three sputum culture early morning, and I will also test HIV.
Okay. Samples positive for TB,
Mm-hmm.
otherwise normal.
Okay.
Otherwise pending.
Okay. Okay. So, Mr. Musa, one question I just want to ask: have you ever? It's a personal question. Have you ever diagnosed with HIV?
No, doctor.
Okay. Okay. So, Mr. Musa, after checking your lab results, your TB test is positive. Okay. So, it means that you are having a condition which is called pulmonary TB. Do you have any idea about this?
Yes, doctor, it's a very bad infection.
Yes. But the good news that the treatment is possible. Okay. So,
Okay, doctor.
okay, so Mr. Musa, it is basically a condition which is caused by a bacteria, which is called Mycobacterium TB, and it affecting the lungs, and it is the infectious disease that it will transmit to other person also. Are you getting my point?
Yes, doctor.
So the good news that previously the TB treatment was 6 months, but now it's reduced to the 4 month, and there are four TB drugs, which is isoniazid, rifampicin, moxifloxacin, and pyrazinamide. We will give these four drugs for the 4 months. For the 2 months initially, and then except for the pyrazinamide, and for the rest of the 2 months. Are you getting my point?
Okay, doctor.
So you have to take these drugs, and if you are a forgetful type of the person, then I will attach you to a program which is dot program, that somebody will come to your house and he will tell you that you have to take the medicine at this time. How about that?
That's good, doctor.
And moreover, just keep you are infectious for the 2 weeks, so avoid how about that, just avoid meeting to other person, and you can use N95 mask. Is that okay? Is that possible?
Sure, doctor.
And as you live in the shared compartment, so how about just separate your room? Is that possible?
Okay, doctor. I
And
will
moreover,
try.
just improve your okay. And moreover, just improve your diet, and increase intake of the protein intake, and increase fresh fruits and vegetables. And we will repeat your test after the after the 2 weeks, okay? And to check your sputum. Is that okay?
Okay, doctor.
Moreover, I am giving you a leaflet. There are multiple side effects of the drug. Just give it a read. And if in case you are having severe chest pain and shortness of the breath, then you have to come back to the emergency department. You have to go to emergency department. Is that okay?
Okay, doctor. Sure, doctor.
Moreover, I am sending infectious disease team to the to your workplace also, so they can test it other persons also if they are having infection or not.
Okay, doctor.
Okay. Uh, Anything else that you want to ask?
No, doctor. Time's up.
Okay.
Okay. So, Dr. Farheen, let's move from first case, then second and third. Your first was rheumatoid arthritis. Patient was first time coming with a stiffness and pain. Sometimes these conditions, like when they come, mostly they will tell you pain. We will have to do Socrates first, but not in detail. Like if it's in hands, stiffness,
Hmm.
pain score, how much is it? And in any part, in any other part of the body, like since when and how frequent is it there, and in any other part of the body. Socrates will include site, onset mostly gradual in these cases, and anything making it worse. Morning stiffness period is important, and then we will come on to the character of the pain. It was aching and throbbing kind of pain. Function is important if we started, if we ask it in the starting. So, did you ask for the red flags? You asked for eye involvement, backache, yes,
Yes.
to rule out other differentials, but red
Yes,
flags in this
encourages
case would be,
spondylitis.
yeah,
Red flags
any
may
these,
be some shortness of breath, chest pain, and I think these will be red flags.
yeah, like differentials can be red flags also to just rule out other diagnosis, like is back pain, any recent infections to rule out reactive arthritis, or any ulcers, mouth ulcer to check any like connective tissue.
Mm.
or rash on the body can be asked. Like two things: any rash on the body or any other joint disease like backache or eye
I have
involvement.
asked backache and fever and weight loss also.
Yes. Then what was there? You need to ask what did she do at home for pregnancy test? She did it or not? Did you ask for the
Yes.
pregnancy test at home? Because she
Yes, I
didn't.
have. I have asked.
No, you did it in the clinic. That was negative, but still we have to ask if patient already did it at home. Okay, and BMI
Yes.
was missing. And when the patient was telling you I'm having irregular periods, it wasn't addressed. If you don't have time, we can say regarding your irregular periods, I want to see you again in the next session or at the end of the session, we will be talking about that. And if you don't get
Mm,
time, just ask two questions regarding hypothyroid and
yes.
shortness of breath to rule out any anemia. So if she's having any feeling more cold than others, secondly, any breathlessness to rule out anemia. Your history was 6
Okay.
minutes and 30 seconds in this
Yes.
case. And she was fond of cooking and knitting. So in
Mm,
that case, we are not going to refer to the occupational therapist. We will just tell her that starting on these medications, uh, we will be your symptoms will improve markedly. And how we
mm,
tell any disease to the patient, we will say it looks like it looks like you have this disease, not you have your rheumatoid arthritis. It will be definitive diagnosis, but still we cannot
mm.
just say it is definitive at here this point. And explain the likely diagnosis. What else was there? Emphasize the importance of early
But
treatment.
if the
You did it.
anti-CCP is positive, so can't we confirm you?
Yes, you can say most likely, and keeping in view the results of your labs, it's most likely that you are suffering from rheumatoid arthritis.
Okay.
But still, before
Okay.
the investigation, we cannot give the definite diagnosis. You said it before investigations, if I'm not wrong. And immediate management in the primary care, you can offer NSAIDs if not contraindication. Otherwise, you gave, I guess, paracetamol and codeine. That will be fine also. And for her heartburn, you can also add any PPI. Not with this, but she's already having, so antacid can be given.
Yes.
DMARC will be started under specialist, so you are referring this patient.
Mm,
Meanwhile, one important thing, since her periods are irregular, needs to know like about contraception. Because if she gets pregnant, one of the hidden thing was we need to tell her
mm,
about the medication and contraception. Because telling
okay.
her, yeah, you might be starting on some medication that is not very good in pregnancy. So whenever you make up your mind for pregnancy, so let us know beforehand, like 6 months before. 3 to 6 months. Then lifestyle, we can encourage her like low impact exercises, discuss healthy weight and balanced diet, smoking cessation if she's doing any. And if she is a teacher or on any occupation, then you can send her to the occupational therapist. In this case, she wasn't a teacher; she was a housewife. And we can tell her you can delay your workings till your symptoms gets better. And
Okay.
support her emotionally, give her if you get time, because this case is kind of long and safety netting then ended. Your next case was cluster headache. The HOPI of the patient, the opening sentence of the patient will give you all the clues you need. Like, doctor, I have this headache and it's 3 to 4 times and it's for this long. I felt that active listening was missing in the second case, as the patient already told for how long. So repetition of question took a lot of your time, and the history went to 7 minutes, 15 seconds.
Yeah.
As soon as we see there is headache, which side is it? And pain score, a little bit of pain score, like how severe is it? Directly jump onto the association. Do you feel any eye pain or tearing or nose blockage or any aura, getting offended with the light or noise? Your diagnosis will be made. Next, um, many of the people are telling that, do you have you ever thought of quitting the smoking? These days nobody is thinking of quitting the smoking. Very rarely we can just ask, do you know about the hazards of smoking? If they say yes, and tell her, if you ever make up your mind, we can discuss in the other session. If they say we don't know the hazard, so I'm going to give you a leaflet, read about it please, and get back to us whenever it's possible for you. You did pedal edema and the basis of lungs in cluster headache. Any significance of that examination?
Just by mistake.
Yeah, sometimes we are in so much flow we do this, but there you have to do cranial nerves and power reflexes, neurological examination basically. So short cranial nerve examination on face, like 1 minute.
Okay.
And proximal muscle strength, reflexes, tone, power, we can check this. And if you don't have time, you can just verbalize like, I will repeat the same on the lower limbs or on your foot. Patient was telling you that, no, I'm taking alcohol. You didn't tell him about the worsening of headaches with this. We need to involve the patient, like, because of your high alcohol intake, this headache is really associated with that. And if you consume more, it will make it worse. Meanwhile, no acute treatment will be given. Verapamil is not given here, and even if it's already diagnosed case of cluster headache, we are not going to start verapamil. It's under the specialist care. How we will manage this patient? Firstly, we can just tell him that you are going through this condition and can give a neurology referral, and tell her, meanwhile, if you ever get the headache, present to the emergency, they will start you on oxygen and
Mm.
sumatriptans, because this is the definitive treatment. No NSAID, no painkillers is needed in this case. And how we explain it to the patient, as you did, that this is not a brain tumor or anything like that. It's some kind of just headache with the unilateral symptoms, and these attacks
Mm.
are managed by some
Comes in bouts.
acute, yeah. And sometimes patient is already having the diagnosed case, so they have oxygen at home even.
Mm. Yes.
Preventive therapy, verapamil under specialist care. Lifestyle,
So,
alcohol, smoking
yes.
cessation. Yes, yes, Dr. Afreen.
So we can just start prophylactic drug, Rapamil, right?
We can start many prophylactic like propranolol, etc., but not verapamil.
Okay, but in cluster
There are
headache,
few
we can,
drugs.
for prophylaxis, we can give Rapamil.
Yes, but not. We are not going to start even any prophylaxis.
And how many, after how many attacks we can offer the patient that go for the prophylactic drugs?
Mostly once it is diagnosed and the patient functional life is affected, like he's taking leaves and it's several times a week, then they are definitely starting on verapamil. That's why neurology referral we can offer over here.
Okay,
But basic point in this is quit the alcohol intake, and it will be very difficult for him. So we can
right.
say that bit by bit, if you decrease the alcohol, it will improve your situation, and maybe you don't need any medication anymore because of this.
Mm.
Doctor,
Okay.
what type of referral is routine or urgent? This
Uh,
case.
you can just state, because here urgent referral can be given because it's 2 weeks referral.
Mhm. Two weeks.
Again, Dr. Kamlesh, it depends on the local guidelines. It's not a hard and fast rule to send the patient urgently, but if his life, like occupation, is affected a lot, he's taking a lot of leave, or he's depressed, or literally giving up, then yes, you have to refer urgently.
Otherwise, just refer.
Yeah, otherwise, just say, I'm going to refer you to the
Oh,
neurologist.
thank you.
And third case was pulmonary TB. The patient, you did good in this history, 5 minutes and 30 seconds. Almost everything was asked, but HIV was asked twice, I guess. And
Actually, I did
sometimes
HIV
people
test
got,
and then I asked for HIV. HIV, is the patient ever diagnosed with HIV?
yes, even if the patient is not diagnosed ever, still we are going to do the test.
So, can we do the HIV test without informing the patient?
Some studies says we have to take like in UK guidelines it is we have to take their consent, but here we will just run some baseline and HIV also.
Okay.
Okay, you reassured the patient. Your starting of the management was very nice. It's you told him that now it's 4 months treatment, but we also have to tell how long he's infectious. He cannot
Yes,
change
I
his
have.
room, but
Yes, I
yeah,
told him that for 2 weeks.
for 2 weeks, and he has to take those 2 weeks off. So one thing was here, you have to write a sick leave or 2 weeks off from the work. No work at the job site.
Mm.
Okay. And side effects leaflet was given. This case was done nicely. Most of the time when TB or these cough symptoms come, sometimes patient has a contact, sometimes they don't have. So still we have to think about TB. Mm,
Okay.
okay.
So, Dr. Sir, can you just
So that
repeat the
was
point of rheumatoid arthritis that you told that if the patient is female patients, then we can say that you are taking these drugs which are not good. So you have to avoid pregnancy for at least 3 to 6 months.
Yeah, we will say I'm referring you to the specialist, and they will be giving and they will be starting you on the medication we call it disease modified DMARS. You can say DMARS in short. And
Hmm.
they are not good, some of them are not good in pregnancy. So if you ever make up of your mind for pregnancy, please have a follow up at least 3 to 6 months before, so we can change you onto the medication that are safe in pregnancy. So for that, and keep on, if she's taking methotrexate, then need to start on contraception, double contraception.
Okay, thank
But
you.
that, yeah, that will come in any chronic already diagnosed case, not in newly diagnosed, because 10 minutes is very short for that.
Yes.
Okay, so Dr. Snober, I saw Dr. Snober was there. I don't know if she's available now. She's not available. So Dr. Amber said, Dr. Kamlesh, Dr. Ambreen, are you there?
Yes, doctor.
Okay, so your patient is 1 minute. Your patient is Mrs. Zoe, 39 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. And your time starts now.
Hello, Miss Zoe. My name is Dr. Ambreen. How may I help you today?
Doctor, I have this worst headache of my life.
Mm-hmm. Can you tell me please more about it?
Doctor, actually, yesterday Today in the morning I was doing something, and as soon as I woke up, I had this severe kind of headache. I tried to take medication, but doctor, it's not coming down. It's thunderclap like headache.
Okay. Uh, since how long you have this?
Since morning.
Since morning. Okay. Last night you were perfectly fine?
Yes, doctor.
Okay. Um, do you feel any nausea with it?
Yes, doctor. Severe nausea, and I vomited also.
Okay. And what about fever?
No, doctor.
Okay. Do you feel any pain in your neck?
No, doctor.
Okay. Is the pain is it pain is in all of your head or a specific site?
Doctor, in all of my head, and yes, my neck is stiff, and also I cannot look at the lights.
Okay. Do you feel your eyes teary?
No, doctor.
Okay. Do you have runny nose?
No, doctor.
Okay. And what about lights?
Yes,
Do you
doctor. It's
feel
regular.
okay? And do you have any recent infection?
No, doctor.
Okay. Do you have pain in any other part of the body?
No, doctor.
Okay. Have you taken any medication for this?
No, doctor. I didn't take any. I just am vomiting. Doctor, I cannot tolerate the pain. Please give me something.
Okay. Are you comfortable? Or please come to the couch. Going to, are you able to take tablet? Or
No,
I'm giving
doctor.
you an injection? Okay.
Yes, doctor.
I'm going. Okay. I'm going to give you injection, diclofenac. I am.
Okay.
Do you feel do you feel comfortable?
No, doctor.
Okay. And do you have pain in your eyes?
Doctor, just my head will explode.
Okay. Uh, uh, just is there any family member with you?
Yes, doctor. My husband is there outside with me.
Okay. Meanwhile, just stay calm and lay down there. I am calling the ambulance for you. And meanwhile, ambulance is here. Is there anything else I do for you?
Doctor, I just don't know. Please do something. Please admit me. Maybe this is something bad with my brain.
Okay. Okay. Just calm down. I'm here to understand your situation. Um, okay. Do you have any chest pain right now?
No, doctor.
Okay. And um, do you feel comfortable? If I ask few more questions?
Yes, doctor, but I'm not comfortable.
Mm-hmm. Okay. Uh, I again give. Do you want if I again give you some medicine
No,
for
doctor,
your pain?
just doctor, I think this was my I have migraine actually in past, but this doesn't seem like a migraine. Maybe some brain the artery has exploded in my brain.
Yes, Ms. Zoe, I understand. It's an emergency situation, and I need an emergency CT scan for you, MRI for you. So I need to refer you to the hospital for this. Meanwhile, uh, ambulance is here. I just uh, I'm just here to reassure you. Is this okay? If I talk to your husband,
Sure, doctor.
okay? Uh, because it's an emergency situation. There might be having. Sorry, I'm confused. Do you have
Doctor, what will they do in the hospital with me?
they are going to do an urgent MRI for you, and if they find that there is an hemorrhage, they are going to give you some medications, or might be if they seem that you need surgery, they might do surgery for you.
Oh,
Is it okay to
okay,
you?
doctor.
Do you understand?
Yes, doctor, I'm really
Uh,
worried now.
I understand your situation. Uh, might
Okay, doctor.
do you do you mind if I examine you?
Sure, doctor.
Uh, First tell me, what do you think that you are having?
Doctor, maybe an artery exploded in my brain.
Hmm. And what is your major concern?
Yes, doctor, I don't want to die.
Hmm. Okay. Mm, okay. What are your expectations?
Doctor, just I don't know. Admit me.
Hmm. I'm
Okay,
sorry, I'm
doctor.
confused.
So for how long they will admit me, doctor, in the hospital?
Um, it depends on the situation that what are you having. If they find any hemorrhage, then they might admit you, and depends. And if they give you oral medication and they feels fine, they might get you might get discharged. But if they feel that you might have to go under any surgery, then it depends that uh, how long it you take to stay in the hospital.
Okay, doctor. So I can drive myself. I will drive myself to the hospital.
Uh, no, Ms. Zoe, as you know, it's an emergency, as you might having hemorrhage in your brain because of your headache. So that's why it's not possible for you to drive. Because as your husband already accompanied you, but still ambulance is arriving in just few minutes here. Oh, is
Okay,
it okay to
doctor.
you?
Okay, doctor. That's it, Dr. Amreen.
Yes.
Okay,
Sorry, I'm totally confused.
it's okay. We'll discuss about it. So your
Hmm.
next case, mm, Mrs. Chloe, or you can say Mrs. J, 29 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. And your time starts now.
Okay. Hello, Mr. Joy. My name is Dr. Amreen. How may I help you today?
Doctor, my stomach has been playing up for months and it's really affecting my life.
Mm-hmm. Can you tell me more about it?
It's been 8 months, doctor. I feel this crampy lower tummy pain and on the one side, and when I go to toilet, it gets better. And it's really getting loose sometimes. Sometimes I'm feeling constipated.
Mm-hmm. Okay. Since how long you are having these symptoms?
8 months.
Mm-hmm. Okay. Uh, uh, can you tell me that how many times you have to go to the washroom daily?
Like 3 to 4 times now.
Okay. And uh, for how many days you have loose stools? And for how
So
many days you have constipation?
on and off. Sometimes I get constipation, sometimes loose stools.
Okay. And with that, do you have any tummy pain?
Yes, doctor, cramping pain.
Mm-hmm. Can you tell me did the pain is all in the tummy or at the specific site?
And it's mostly in the whole tummy, mostly lower tummy, and when I go to toilet, it gets better, doctor.
Okay. Can you tell me that do you have any blood in your stool?
No, doctor.
Okay. Do you ever feel any fever with it?
No, doctor.
Okay. And uh, do you feel any nausea or vomiting with it?
No, doctor.
Mm-hmm. Uh, do you think that any factors that aggravate your condition?
Doctor, mostly stress at work and sometimes certain foods aggravates it, and I also feel bloated a lot.
Mm-hmm. May I ask you about your diet?
I'm taking junk food mostly outside, some fatty foods.
Mm-hmm. Okay. And what about your sleep?
Doctor, my sleep is fine, but these days, since 2 weeks, I'm a bit stressed.
Mm-hmm. Okay. And what about your weight?
It's 21 BMI.
Mm-hmm. BMI. Do you recently change in your weight?
No, doctor.
Mm-hmm. Okay. And what about your mood?
More just stays all time anxious.
Mm-hmm. Okay. And what about your interest in daily activities?
Doctor, I'm interested, but sometimes the stress doesn't let me do anything.
Mm-hmm. Okay. Do you mind if I ask you a few personal questions?
Sure, doctor.
Do you smoke?
Yes, doctor.
How many?
10 cigarettes since 10 years now.
Mm-hmm. And what about alcohol?
On weekends.
Okay. And do you have any surgery in the past?
No, doctor.
And do you have any long-standing illness?
No, doctor.
Are you taking any medication for any illness?
No, doctor.
Okay. Do you have any family history of any problems of the stomach, like celiac
Doctor, my
disease,
mother has
IBS?
similar. Yes, my mother has similar IBS problem.
Okay. Okay. Uh, can you tell me that what do you do for a living?
I am a student right now
Mm-hmm. Okay. And with whom do you live?
with my mother.
Okay. Are you married?
No, doctor, but I'm in a relationship
Okay. What about your last menstrual period?
2 weeks ago.
Mm-hmm. Okay. So, Miss Joy, what is your idea? What are you having?
Doctor, I feel like I'm having similar same condition like mom.
Mm-hmm. And what are your major concerns?
I just want to get medicine, and but I don't want any long-term medicine.
Mm-hmm. I understand. And what are your expectations from this consultation?
Any management plan.
Mm-hmm. Okay, let's discuss it later. And can you tell me that how's this condition, your condition, impact your life?
Doctor is just worried because every time I'm stressed, I have to go toilet a lot, and this bloating is really making me embarrassing.
Mm-hmm. Okay. Do you mind if I examine you?
Sure, doctor.
Okay. After sanitizing and in the presence of a chaperone with complete privacy, I'm going to do a general physical examination and I check vitals and I look hands um, and look eyes for the anemia and any jaundice. And I also look the lymph nodes, especially the left supraclavicular lymph nodes. And on the GIT examination, I do inspection, palpation, and percussion and auscultation for bowel sounds. Is that in final?
Okay. Yeah, just 1 minute. BMI, as I told you, 21, otherwise mild tenderness in left iliac fossa, no masses, otherwise normal.
Okay. As Miss Joy, according to your history and examination, I might think, according to me, you are might having IBS as your already family history, your mother also suffering from this. Do you know what is IBS?
No, doctor. Just it's kind of a stress condition, I know.
IBS is a irritable bowel syndrome. It's a condition in which there is some mucosa of the of your bowel wall irritated, and you might having sometimes diarrhea, and sometimes you have constipation. Do you get it?
Yes, doctor.
Okay, Ms. Joy. For this, firstly, you have to do some lifestyle changes. Is it possible for you?
Sure, doctor.
As you are taking very much junk food, so you have, is it possible for you that you can start a healthy, taking fresh vegetables and fresh fruits in your diet?
Sure, doctor.
Okay. And just if it's possible, then start early morning exercises uh, daily, or you do yoga, as because you're already in stress and anxiety. It's better to cope with it, because as you know, while walking or jogging might help to release your stress, and
Okay,
you might
doctor.
become active for the day, rest of the day. Okay. And
Mhm.
secondly, it's not a dangerous condition. It's very much treatable, and with the lifestyle changes and proper medication, you can recover it. Is it okay? Do you get it?
Okay, doctor.
As Ms. Joy, you are already told me that you are a smoker. Is it possible you ever think of quitting smoking?
Sure, doctor. I'll try.
Sure. If you want, we discuss it in another session. And also, as alcohol is, is not healthy, and you're already having your stomach or large bowels issue. So that's why I think it's very much better that you try to think of either decrease initially, try to decrease your quantity, and after then, you might think of quitting it. Is it possible for you?
Sure, doctor. I'll try.
Okay. Uh, uh, for its treatment, you might get some. If you feel any constipation, you might get like add laxatives in your uh, diet. But if you take fresh vegetables and fresh fruits, you might condition get settled. Is it okay?
Okay, doctor. Okay, doctor.
Okay.
Time's up.
Uh, okay.
Right. So, Dr. Ambreen, it was
Yes.
two cases. So, and one case I'll be giving to Dr. Kamlesh.
Okay.
So, let's talk about these. Firstly, first case was a subarachnoid hemorrhage.
Yes,
Um,
actually,
it was,
I even didn't go through this topic, so that's why I'm very much confused.
yeah, this is one of the like headache differentials they are giving in OSCE a lot. And
Firstly, please
obviously,
tell
this
me,
is
is it
emergency.
an acute emergency case?
Yes, yes. This is like
Okay,
just admit the patient. Don't give anything to the patient. Just check vitals if you can. And that's very important. Vitals are very important in every case.
okay,
As soon as
okay,
patient is telling you, I'm having thunderclap headache, you have to
okay,
call your staff, check the vitals. I'm arranging ambulance for you. Meanwhile, can you please tell me, was this is the first time, and for how long it is? Nausea, vomiting, two things, photophobia and neck
okay,
stiffness. These four you can ask. These will be positive, and then past medical. If just ask, do you have any previous history? She might be having any high blood pressures or migraine. In this case, it was migraine. Directly jump to the family history. In your family, anybody had any brain problem? Her uncle was having the brain aneurysm rupture,
Okay.
and
But
whenever there is,
as I'm sorry to interrupt. As you are a patient, as an SP, you told me that I'm in very much pain. Please just do
yeah,
something. Then in that situation, what can we do? What should we do? That if patient is not telling anything, and he's continuously saying that no, I'm in pain. Do
yeah.
something. Do something. Do something.
Yes,
Then
because this patient will be cunning a lot because this pain they are not even they don't even want to talk in real life. They want just you to admit the patient and any morning headache severe that is a thunderclap 10 out of 10. Don't dig a lot in the patient's history. He's asking you to give him something. Okay, don't give him at the moment anything, right? Don't worry about giving
okay.
the painkiller
No,
right away.
no
Tell
any
him
tablet
yes
or pain
doctor.
injection.
No, 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 not no, nothing at that moment. Just tell her,
Okay.
him or her, I am calling my staff nurse. We are checking your blood pressure and pulse, heart rate, oxygen saturation, everything, ECG, all also. And meanwhile, I am calling the ambulance. Just want to know if you ever had this before. No, doctor. Do you have any nausea, vomiting with this nausea with this, or any vomiting episode? Do you have neck stiffness?
Okay.
Okay, fine. Any past medical history, previous history of anything, migraine or high blood pressure? In your family, anybody had any brain problem, brain hemorrhage, Mr. Clay? Yes. Okay, what do you think about your condition? What's going on with you? Ice should be like jumped suddenly on that there. We cannot delay this case. And even if you finish this case in 6 to 7 minutes, it won't be wrong thing.
Okay.
Okay, because
I
emergency
That's
case
where I'm
means ABC
confused.
protocol. Hmm?
Yes, I reached the diagnosis, but here I'm confused that there's too much time left. Now, what can I do?
Yeah, you don't have to like finish the time in emergency cases. In real life, we have to be like 5 minutes. Then do the management.
And as if the patient said, a female patient said, my husband is here, should I go with her? Then what should I say? Okay, no, wait for an
No, you
ambulance
are
or
yeah, yeah, arranging the ambulance. My staff nurse will go because on the way there might it might happen something bad. So
okay,
always refer through the ambulance. These any kind of emergency patient.
okay,
And tell her
okay,
that your husband will be accompanying you and I'm sending my staff nurse with you. Meanwhile,
okay.
in this case was examination. You will do all the vitals along with GCS. She was
Mm-hmm,
oriented cranial nurse. You can do neck stiffness. You can check on passive flexion. And
mm-hmm. Okay,
otherwise no investigation is needed in this case, but you're telling the patient after right after ice. What do you have an idea about any concern, any expectations? Impact in this
mm-hmm,
case, you can ask like how it impacted your life. She might have taken the leave today. Okay, so Mrs. Chloe, as you told me, and regarding your examination, after your examination, I feel like you're going through condition. We call it subarachnoid hemorrhage, and it's an emergency condition. That's why I have to admit you. This is basically a bleed. It could be a basically bleed in the brain, as your uncle had, and that's why I have to refer you as soon as possible. Doctor, what they will do to me in the hospital? They will patient will ask you.
mm-hmm.
Okay, they might give
Then
start
what should
some
we tell?
CT
Okay.
scan. They will firstly
Mm-hmm,
do the CT scan of your brain, and after the specialist
okay,
input, they might be starting you on any medication, or if there is any procedure needed, they might do it. But for your safety, I have to refer you as soon as possible.
okay,
And safety netting, like we need to talk a lot about your condition. As soon as you get discharged from hospital, I want to see you. Would that be okay? Then finish the case. We don't have to drag this case till 10 minutes. If the end it's 7 to 8 minutes, you did the case. That's fine.
okay, okay.
The next case was, and we have to verbalize what the patient is having, like subarachnoid hemorrhage. We have to say it
Mhm.
out loud. Mm,
Okay.
The next was IBS.
I'm sorry, Dr. Saran. Should we ask these on the chair or we take him to the couch and there I can ask these questions?
You just can say that, are you comfortable sitting? You want to lay down. Patient mostly stay seated because there's so much high pressure, and they don't even feel relaxed while laying down. So sitting is better for them.
Okay. Okay. Okay.
Okay. You can give
Okay.
them the option, but don't stress over like, can you lay down on the couch? Ask, are you comfortable sitting here or laying down? The next case was
Okay.
newly diagnosed IBS. The patient was already telling you straightforwardly that I have constipation and off and on and diarrhea for a few months now. I felt active listening was a bit missing. She already told you it's 8 months and it's crampy pain. So when you asked questions again, it took your time.
Okay.
With the constipation and loose stools, how many times you go to toilet? Like how many loose stools she has? Meanwhile,
Mm.
pain does pain gets better after toilet, and bloating. Your diagnosis is made. You can just for differential ask, do you feel any blood? And how
Mm.
about your personal life? Are you being stressed these days? These all will be
Mhm.
positive mostly. Then one question, any long-term illness? Are you on any medication? Family history? And a little bit about smoking and alcohol. Come to eyes.
Mhm.
Then examination is mostly normal, in this case mildly tender. Investigation you didn't do in this case because even though it's IBS, but to
Yes.
support my diagnosis, I want to run some blood tests like CBC, CRP, ESR, celiac screen, thyroid function test, and one question for that also. Okay,
Okay. Okay.
but if you feel it's IBD, then which test you can do? Stool
Uh,
calprotectin,
Stool calculator. Okay.
but not in this case. Mostly when you feel blood in diarrhea or any
Okay.
oral
Just to
ulcer.
differentiate Crohn's or ulcerative.
Yeah.
Okay.
When it's Crohn or ulcerative, then you will send for the calprotectin. Otherwise,
Calculator.
CBC, CRP, ESR, celiac, and thyroid in IBS. Okay.
Okay.
You will
Okay.
explain the diagnosis mostly is related to your stress and um, it's a gut sensitivity to brain gut axis, you can say, and it's very troublesome. You didn't give any pharmacological medication like pharmacotherapy in it. Okay, first we go
Okay.
on to the lifestyle and diet. Regular meals, do not skip meals, do not eat a lot of meals, also chew slowly.
Okay.
And limit caffeine, alcohol free sittings if they are taking. Start on low FODMAP diet. I will be giving you the leaflet regarding this diet, okay? And medications, we can start on the antispasmodic. You can say meberberine. I'm starting you on
Remember.
meberberine. Yeah, 135 milligram 3 times a day. And also, if you have constipation, then we can start on Spagola husk, etc.
Okay. Whenever she
Okay.
feels loose stools or colic abdominal pain, then she have to take it.
Yes, mostly. And if she's having
Antispasmodic.
diarrhea, like right now, she's having diarrhea 3 times a day, she's going loperamide as needed. Okay.
Mm-hmm. Okay.
Psychosocial decrease in stress, try to stay and try to walk, as you said, and deep breathing exercises, relaxation techniques, and if needed, you can attach her to CBT. Safety netting, like any blood in the stool, or you cannot 7 to 8 stools a day, then you present to us as soon as possible. Okay.
Okay. Thank you.
Okay. So, Dr. Kamlesh, are you there?
Yes, yes.
Yeah, I have the last case, so we'll go on that. Your patient is Mr. Daniel, 44 years old male, came to discuss his problem. Please proceed with history examination and management plan. Your
Sure.
time starts now.
Good day, Mr. Daniel. My name is Dr. Kumar. How may I help you today?
Doctor, I cannot hear you clearly. I'll stop the timer.
Can
Hello?
you hear me now? Yes, can you hear me now?
Yes, I can hear you now. Your time
Okay.
starts again.
Okay. Good day, Mr. Daniel. My name is Dr. Kumar. How may I help you today?
Doctor, actually, I have this terrible pain in the top of my tummy and it's not going
Mm-hmm.
away.
I'm sorry to hear about your tummy pain. Can you tell me something more about your tummy pain?
Yes, doctor, it started just suddenly 6 hours ago and it's in the middle of my tummy, central upper abdomen and it's radiating to the back, doctor.
Uh-huh. And is it okay to understand better about your condition if I ask you more question about that? And is it okay with you?
Sure, doctor.
So you told that it started about 6 hours before. So how it is started? It is started suddenly or gradually?
Yes, doctor, suddenly, I don't know how, but it's
Mm-hmm.
severe, constant, boring pain.
Okay. And if I ask you, is this pain is going somewhere else as well, apart from back?
No, doctor, only back.
Okay. And if I ask you the severity of pain, let's suppose 1 is minimum and 10 is maximum, how will you rate it?
9 out of 10, doctor. I just cannot sit. I cannot lay
Uh-huh.
down. Please.
So, okay, I can see that you are in the pain. Is it okay if I offer you to come on the couch so that we can talk and I can examine you very.
Doctor, I cannot lay down. I cannot lay down.
Mm-hmm. So, anyways, so just understand better. You told this is in the epigastric going back, right? And it is 10 out of 10. So, is it okay if I can see your tummy and you have to remove your shirt up to the level of nipples? And if you need, if you are uncomfortable or anything, I can call the chevron to help me out in this process. Is it okay with you?
Doctor, I just cannot sit straight. I'm bending forward just because my pain is not letting me sitting straight.
Mm-hmm. So it's okay. So is it okay if I examine you, even you are sitting over here? Just want to say, if I will see it, I will touch it. I will
Okay,
try to
doctor.
listen the sounds. If there's anything, or if you feel pain, you can stop me anytime. It's okay.
Okay, doctor.
Okay. First, I will check your vitals, vitally like plus pulse, blood pressure, your respiratory rate. I will check. I will check if there is any tenderness in your upper abdomen. Okay. I will listen any sounds in the gut. And apart from this, if I will check your temperature, everything. So anything in that?
Temperature 38.2.
Mm-hmm.
And a severe upper abdominal tenderness. Patient doesn't let you examine anything else.
Okay. And with this pain, have you noticed any? You have to throw up, like vomiting.
Yes, doctor, 3 to 4 times.
Okay. And so how about that? If we, it seems like it is some emergency. We call it acute pancreatitis. Are you getting me?
Yes, doctor, what is it?
Actually, it is a condition in which an organ in our body we call as pancreas is getting inflamed. Okay, and because of that, you are getting this pain, and this is an emergency. Okay, so how about if I send you to the emergency department with your permission? And is there anybody with you in today's consultation, please?
No, no, doctor, I came alone.
Okay, so you want me to call any of your family member if you are allowing me to send you to the hospital?
Yes, doctor.
Okay, so just give me the number. I will call my staff to arrange the ambulance. In the meantime, they will call your family member to come with you to be with you in the hospital. In the meantime, is it
Okay.
okay if I give you some medication to relieve your pain?
Yes, doctor, please.
Okay, so in this case, I will maintain your IV access line. Okay, and I will give you an injection. We call it diclofenac to relieve your pain. It's an inside injection. Is it okay with you?
Okay, doctor.
Okay. So until the ambulance reach is it okay if I ask you a few more questions? Like, do you have any high blood pressure before?
Yes, doctor, I have this high blood pressures.
Okay. What are you taking for that?
Ramipril.
Remipel. Is it controlled, this blood pressure?
Yes, yes, doctor.
Okay, that's good. That's good. You are taking it regularly, it means, right?
Mm.
Have you ever suffered from the high glucose level or sugar levels?
No, doctor.
Okay. Have you done any type of surgery in your tummy before?
No, doctor.
Okay. Apart from this, any other medication you are using for blood pressure?
No, doctor.
Okay. Okay. And do you feel this pain is means going sorry on the tip of your shoulder as well?
No, doctor.
Okay. Do you smoke?
Yes, doctor. 2 to 3 cigarettes a day.
Have you ever think about to quit the smoking?
No, doctor.
Okay. How about if I provide you the leaflet at the end of our consultation? When you go from here, go once you will be free from hospital, go through that, and if you ever think about to quit, I am here to help you out in the next consultation. Is it okay with you?
Sure, doctor.
Okay. How about do you drink alcohol?
Yes, doctor. So much. Mostly 6 to 8 beers on Friday and Saturday.
And since how long?
Since many years now.
Okay. Have you ever suffered from any stone in the gallbladder?
No, doctor.
Okay. And do you have any idea about your weight to your height?
And doctor, my weight is increasing 33 BMI
33 BMI. Okay. And with whom do you live at home?
with my wife and 2 kids.
And everything is okay at home?
Yes, doctor.
Okay. What do you do for a living?
I work as an accountant.
Okay. And how about your dieting habit? Diet habit?
Doctor, mostly takeaways and junk food. I'm taking these.
Mhm. Okay, and okay, I have already examined you. So once you will be free from in the hospital, when you reach there, maybe they will do an scan of your tummy to confirm the diagnosis. Okay, because this is most seems like you have this acute pancreatitis. Okay, and once they
Mm-hmm.
will manage you over there, they maybe check your CBC level, your ESR level, your LFT levels, your lipase level, CRK, kidney function test. Also, the scan, we call it CT of your abdomen or tummy. Okay.
Okay, doctor.
Okay. Actually, and once you will be free from hospital, okay, I will
Mm.
please come back to me. We will discuss about your future plan for your treatment regarding this issue. Okay.
Okay, doctor.
And in the
Okay.
meantime, I will advise you to cut down the alcohol because it also increases the symptoms or the things which you are feeling right now. Are you getting me?
Okay. Okay, doctor. Can you
Okay.
give me something for my vomiting? I want to eat something. I'm hungry.
Yeah, sure. I told my staff to give you this metoclopramide 10 milligram
Hmm.
IV slowly to
Okay.
decrease the symptoms of the nausea and vomiting. Okay. And once you will reach hospital, they will start to treat you according to the condition. Maybe they will give you some or more strong painkillers like morphine or pethidine according to your condition once you will be there.
Okay, doctor. So, doctor,
Okay.
I want
And
to eat something before going. Is it okay?
so I gave you diclofenac sodium. I have maintained your IV line. I am going to give you this normal saline 500 ml IV.
Hmm.
Okay.
Okay.
And until they will come and the next because you cannot take anything right now. Maybe they will suggest for you any one uh, what we call it a procedure ERCP.
Okay, doctor.
Okay. So maybe for that one, you need to be nothing to eat by the mouth because it is the requirement for to go through this procedure. Are you getting me?
Okay, doctor. Okay, yes,
Okay.
doctor.
And once they will remove stone or whatever the thing is causing it to for you, then they will start for you antibiotic as well.
Sure, doctor.
Okay. Is there anything else coming crossing your mind and you want to discuss with me?
No, doctor. That's all.
Okay. Anyways, thank you. Take care, and I will see you once you will be coming back from the hospital. Hope for the best.
Okay.
Thank you.
Thank you, doctor.
Thank
All right, Dr. Kamlesh. Nicely done. It was
you.
acute pancreatitis case. And
Mm-hmm.
sometimes patient doesn't let you examine, but mostly they let you examine, but telling you I'm so much in pain.
Mm-hmm.
Um, you asked about onset, site, character, severity, associations.
Radiation.
Mm, yes, radiation, fever. Wasn't asked, but you did on examination, so it was
Mm-hmm.
fever and chills.
Mm-hmm.
Strongest risk factor was here. Alcohol. Did you address it at the end? Alcohol was is one of the cause that might
Yes.
have.
Mm-hmm. And
We
also
have to.
obesity and previous history of stones as well.
Uh, previous history. There was not any previous history of stones or anything. It was mostly alcohol.
Alcohol and obesity
Yeah,
is a little bit regarding obesity. I told like means, I'm not
obesity
quite
is not the
sure.
cause of
Mm-hmm.
acute pancreatitis, but is the cause of
Cholecystitis, I think
causing
obesity. Yeah.
gallstones. Yes.
Yes. Yes. Cholecystitis.
Yes, and then past medical history you asked. Eyes should be asked early in here. Even though you did right, you went through the ABC protocol, but you
Mm-hmm.
could have asked like as soon as you examined, what do you think what's going on with you? You skipped eyes basically. You
Because
didn't
there
ask it.
was an emergency response, so my main focus was to convince the patient to send patient to the
Yeah.
because it was emergency. We cannot delay this.
Yes, actually these cases are just to check your nerves basically, even
Yes.
over there. So
Yeah,
if
sure.
you
So I
forget
don't know
eyes,
because at that time I have also gone through the books telling whenever you feel anything suspected like emergency, go with the
hmm,
emergency response first. Once you have managed in the
yes.
emergency, then whatever you have to do, you have already passed because you have already know this is the emergency.
Yes, yes, that is the basic thing over
Mm-hmm.
here. Again, do not forget ice, even though you did, you gave painkiller, etc. Even after that, whenever you remember in the case, even at the end of the case, like when you were talking, what do you think what's going on with you? Do not ever leave ice before leaving the room. And
Yes. Yeah.
any red flags like chest pain or radiating to the jaw, because sometimes
Yes.
patient is diabetic and they are just coming with tummy pain, and mostly it's not that severe. In diabetics, they're very vague pain in the upper tummy for ACS, and
But I
it
think,
the
doctor, the severity by itself is a red flag, 10 out of 10 or 9 out of 10.
yes, yeah.
And DD, I made it
So
that
just
in
to just for
cholecystitis, hip of
DDs,
shoulders. Yeah.
just for DDs, we have to ask like any radiation to the armors, or
So,
anyways you asked about any other radiations.
yeah,
So
cholecystitis,
examination
hip
was
of.
done.
Yeah.
Examination was done. Investigation. Did you verbalize which investigation they'll be performing?
Yeah, all CBC,
Exactly.
CRP, and like LFT, and for the pancreatitis, everything I asked the
Hmm.
patient for.
Amylase and lipase.
My
If you
lipase I
don't
asked.
say this.
Lipase I asked.
Hmm. So now more specifically, it's lipase
Yeah, lipase
and
I asked for.
also CT. Also CT and ultrasound management plan on your
Hmm.
way how you will tell the patient that is mostly the inflammation, or you can say um, it's an inflammation. How is the other word you can say it? Explain that he needs that urgent assessment for pain control, IV fluids, imaging, and
Mhm.
monitoring. Okay, and nil
We can
by
only
mouth.
give IVs and painkillers.
Yes, you can say over here like the severe pain is because of a organ we call it pancreas. It's affected because of increase in alcohol intake that you've been taking. That's why causing you severe pain. That's why we are referring you to the emergency department. Nil by mouth. Mostly they
Mhm.
won't ask you they don't keep on asking you like should I eat? I was asking you, but there you have to tell it by your own self. make nil by mouth. Give
Same I
strong
applied here.
analgesia.
Yeah,
Yeah,
me too.
strong analgesia is not diclofenac is not a strong analgesia. So first line in any pancreatitis case, we have to verbalize pethidine.
So I think Doctor here I told because I just have to ask you as well that I told maybe in the hospital they have the stronger like pethidine or morphine they can give you to relieve your pain once you will reach the hospital. Because my understanding is
Yes.
mostly in the small centers we are not keeping morphine or pethidine. Here in UAE, I don't know about means in
Yeah, no,
South Asia.
peptide is a fully controlled medication we are
So
giving.
that is why I meant I was confused. I
Again, it,
told that they can give you in the hospital. Told the
yeah,
name
you
also.
verbalize it. And also, it is on the local guideline, doctor. Obviously, it is control medication, but here, diclofenac won't do anything. You can just verbalize that the stronger medication can be given you to the hospital, as you said, pet 13.
Yeah, I
But
told the same.
diclofenac
Pethidine and morphine
has
both
no
I told.
role over here.
Yeah,
Yeah.
I told the same.
Hmm. And according to the local protocol, that's why whenever you are verbalizing anything, you can just say, according to my local protocol, I'm going to give you diclofenac. Because if some examiner want to hear pethidine, they would know in your local area you don't have that controlled drug.
Yeah.
Okay. Like typhoid, we have to say it like according to our local guidelines. I'm going to start you on azithro or ceftriaxone or whatever. You have to say it in the exam. Again, safety netting for any for emergency case, like I want to see you back. We need to talk about on your alcohol intake and other lifestyle. Would that be okay? That's all. And associate, as you did very good, contacting to the family and accompanying him. So this in every emergency case today there was two or three cases of emergency. So it is mostly ABC protocol. Keep your history short. I asked eyes in the early stage, and then manage the patient if you can, and then refer. Any queries? Okay. Yes, Dr. Farheen, we will verbalize about pethidine, but always say according to the local guidelines. Thank you, doctors. We'll be stopping our session over here.